So, according to World Health Organization, a healthy workplace in which the workers and the managers work together as a team, collaborate for a continual improvement process to protect and promote the health, safety, and well-being for the workers and the workplace together. So, it is a sustained teamwork, right? Cannot be done individually. So, what is the need of a happy workplace? Why you need to be happy most of the days at your workplace? Because we obviously, when we are happy, we are more motivated, we are more energized, we are more engaged with the patient, right? So, our productivity increases several pounds. So, what if you are chronically unhappy at your workplace? So, the moment you get up in the morning, the entire thought of going to your work just makes you feel sad. You're just not motivated for your work. The just thinking about it induces negative emotions in you, and it affects the other parameters of your life, right? So you feel exhausted all the day. So what is it actually? So is it something new? No, it has been there ever since the time immemorial. It was first described in 1970s primarily by Maslach. So Maslach described it as a set of psychological problems among the people who work with people. People work. So what do you mean by people work? Those who have a lot of interpersonal interaction, those who work as team, and those who are exposed to a lot of emotional responses. So it is very prevalent in these sectors. So they described burnout as a psychological syndrome. So it's a marathon, right? So a marathon means it has been something which has been chronic. So it is chronic exhaustion, cynicism. Cynicism means apathy, disengagement, loss of motivation, and your perceived inefficiency. You feel inefficient and inept in your work. So how did it actually arise? So there has been a prolonged response and exposure to the chronic workplace stressors, to which now your system has become disengaged. You feel apathic. You do not like to engage in the patients. You do not treat them as humans altogether. You treat them as diagnosis. Okay, well, I'll read this in this diagnosis. I may as well treat it, right? So a doctor who is burnout usually says what? Let's listen to what this doctor is saying. I'm frustrated. It is usually, it's really getting impossible to do a good job. The situation is just getting worse every day. I've lost my motivation and enthusiasm to work. And I feel really, really overwhelmed with any amount of work I'm offered, and I feel trapped. I cannot, I do not find a way out of it. So it's a process. It does not develop in a day. So what really happens? So when you are exposed to high workload, unprecedented amount of high workload, so you give a lot of fuel to it, right? You are engaged to it so much that eventually you feel exhausted, emotionally, mentally, and physically exhausted. Your fuel gets to get it starts getting over. So what happens to a vehicle in which the fuel is over? Right? The vehicle doesn't start, it doesn't engage. So you feel apathic. You don't feel like engaging in the work. You feel disconnected. So what happens to a vehicle that is not moving and working for days altogether? The vehicle is stuck. So at the end of it, you feel you are stuck, you are helpless, and you are entrapped with despair. So that is where you are hitting the wall. That is where your productivity goes to the lowest. So this is global analysis by Medscape in 2022. So what contributes most to the burnout? What are the triggers for it? So global analysis and examination for several physicians and doctors altogether, too many bureaucratic tasks. What are the bureaucratic tasks? Too many overwhelming amount of paperwork. You are spending more time with the files than with the patient. So this is the topmost factor for the burnout, right? The second most important factor was lack of respect from the administrators and employers. You're not, they are shown, the healthcare workers are shown that they are not valued by the system, and obviously too many hours at work. One important thing that the doctors felt they had no autonomy and control over their work. So they cannot, they don't have any control to take the decisions regarding the patients. They do not have any control to take decisions about their schedule. So these are the top four contributing factors towards, triggering burnout, right? So, is there any contribution for the specialty in which you are working? So obviously, it is there's no basis for it. It is emergency medicine and critical care medicine. So, why are these people most vulnerable to to burnout? I'm sorry, because these are the people those who are exposed to the most critical set of patients. So these are the people who are exposed to the most interpersonal interactions, and they are the ones who are exposed to the longest working hours, most amount of paperwork, and they have been exposed to the most amount of emotional responses from the relatives, from the other consultants as well. So these are the doctors who are at the highest risk of burnout. So, is there any contribution of your personality, the kind of person you are? Would it contribute? Will you be burnout or not? So there is a slight, propensity for type A people to get exhausted at work earlier, because type A people are more prone to anxiety. They are hyper competitive, and they are over engaged. They run out of their fuel earlier. But on a larger analysis, it was found it didn't contribute much, because burnout is not an individual problem, it is an organizational problem. Your work culture will affect more than your personality. So, is it so the younger or the older or everyone of that 35 to 65 years of age, they all suffer burnout at the same amounts? It is unrelated to your age, it is unrelated to your experience. All of us are in this together, whatever age you are. So the picture says it all. Why are the females more vulnerable to get burnout? So you can see the picture, it says it all. Because of the social construct, more often than not, we are the primary caretaker. So we have more responsibilities apart from the workplace responsibility. So, what actually is the effect on the physician, the mental, physical, and the emotional effect? So, the physician feels that he or she is unable to focus, easily fatigued by even trivial amount of mental stress. So, there will be obviously increased amount of medical errors, diagnostic delay, disengagement from the patient. We will spend less amount of time with the patients, right? So there is a little motivation to reach out to others. There's a little motivation to call out for help. There'll be inappropriate behavior at the workplace. There'll be violent outbursts at the workplace, even at the smallest amount of trigger. So these people will be, very well known in the institution of having inappropriate behavior and aggressive outbursts at the workplace, right? So there'll be a lot of physical effects as well. So this is also known as workplace neurasthenia. The physician will complain of muscle aches and pains, headache, sleep disturbances, and inability to relax. Inability to relax from the things that earlier used to bring you joy, right? And the duration of the disorder is, it is prolonged. So, as I said, it's not an individual problem, it's an institutional problem. The organization also suffers. So, there is overall a reduced job performance because of the culture of your organization. There will be reduced commitment, and there will be a very high physician turnover. So, the people will be easily leaving your institute, you'll be recruiting new people, and then after some months or years they'll be leaving again. So it is a very high amount of turnover. So it has got a cost benefit effects on the institution. So there'll be higher amount of absenteeism, and there'll be distrust in the management, peers, and supervisors. Okay, so how do we say it is different from stress? So what I can say is stress produces an acute response in your body. So you will be over engaged. Stress makes you hyper, right? So it makes you anxious. So what if the stress is chronic. If the stress is chronic, it will lead to burnout, right? So when you are constantly using your fuel, you run out of your fuel. You feel bloated. You feel helpless. I am not into this, and I don't feel like doing this. So just see what the doctor is saying here. I'm chronically stressed, and now I'm feeling burnout, right? So how to measure it? So this thing is known as mass snatch burnout inventory. So this is like you need to introspect, sit back, sit for 10 minutes and fill this inventory that will be distributed to you at the end of the lecture by Asha. So in this inventory or questionnaire, uh, so I'll measure your emotional exhaustion, how disengaged you are from your patients, and how do you perceive your personal accomplishment? Do you think you have achieved something in your life? What is the purpose of it? And if you feel too bored to fill it or even look at it, that means you're already burnt out and you need to do something about it. Okay? So you need to introspect, sit by yourself, and fill it properly. So now how to tackle this? So I will use two very fancy terms, resilience and anti-fragility. So just as a common English word, what do you mean by resilience? Anybody? Resilience का मतलब क्या है? So a resilient person is someone who can, adapt, someone who can adapt to the stress or negative or challenging environment, right? And what is an anti-fragile system or a person? An anti-fragile system is okay, you will adapt, but also you will see the setback as an opportunity to grow. Okay, so it is above resilience, it is anti-fragile. So, how to, I mean, what are the qualities of an anti fragile person and a resistant and resilient person, right? So, a person who is resilient and anti fragile will see the setbacks as temporary. It is not going to make any permanent effect in your life, come what may. So, we will analyze the root cause of any setback, okay? And we will see this setback as an opportunity to grow, okay? And we will just focus on the events in which the events that we can control, the events which are in our hands to control, right? And obviously, we will just prevent any strong emotions and impulses. We will not act on strong emotions and impulses. And we should see an overall development, well rounded development of our life. We will focus on our interpersonal relationships, our work outside the hospital, and we will never see ourselves as a victim. So, these are the characteristics of a resilient and anti fragile person or a system. So, how to build this up? What can we do as physicians, right? So, we have to figure out our relaxation techniques. So, in a global analysis of the physicians worldwide, most of the physicians prefer to exercise as they find time for exercise as a self relaxation technique. So, you have to figure out the things that give you joy, right? You have to figure out the things that you can express gratitude, the person who have brought a change in your life and to whom you can express gratitude. Time management, you have to take break, because if you don't plan a break, your body will plan a break, and that wouldn't be a very convenient time. Anytime your body will plan a break, you need to schedule your breaks. So instead of me, you have to work as we. We need to have very strong team working skills, reaching out to the community, and interpersonal interactions play a big role in our life, right? So we need to have a problem solving and a critical thinking skills and attitude. So and now, what is self awareness and mindfulness? Self awareness means that you are, very much aware of how your behavior would be and how you will react to a particular situation. Okay, so you need to just introspect yourself when you are put in a particular situation, how your behavior would be and how you can and what you can do to make it better, right? So, what the organizations can do. So, at the time of induction of any healthcare professional or any employee, there should be a clarity of job profile. The job profile, the responsibilities and roles should be elaborated. The anticipated amount of stress that person is going to face should be elaborated. Okay, then if there is any adverse event or any stress, the organization, the administrator should be very responsive to it, and there should be a common platform to listen out to it. Okay, so the doctors should be encouraged to take leaves. It should not be a thing. The doctors should they cannot take leave. They cannot get tired. And we all are humans. We do need leaves, right? So there should be a zero tolerance policy for any inappropriate behavior, any aggressive or violent outburst. So this includes not only physical but verbal or cyber based. Any inappropriate behavior needs to be reported, and the organization, it's their duty to act on it. So, and also as Indians, we have a lot of stigma about mental health. Anybody who says, I feel sad, I feel depressed, it comes, that person automatically comes under the radar of inefficiency. Okay, this doctor is depressed, cannot work properly. So we need to destigmatize the mental health, that the stigma around the mental health, the conversation around the mental health should be made very normal. So if how many of you know we have an employee assistance program in CIMS? So nobody. See, reaching out to community, it's like it's poor here. So we have an employee assistance program. It deals with these matters only. So if you're feeling blue chronically, you're not feeling well at your work, so you can reach out to the committee members of employee assistance program. So what we right now lack here is this regular assessment and mental health support services, for which we will need PATSA to make frequent mental health rounds, to have counseling sessions, quarterly counseling sessions with all of us, how, or a questionnaire distributed to all of us, how do we feel with our work, how motivated we are for our work, and what could be done to make it better if we're not feeling good about it, or what else we can do to our system, that we should have interdepartmental mental health or well-being facilitators. So they would be the people who would be, contacted first. If you feel, if any of the person of the department feels blue, I'm not okay today. Okay. So what could be done to help the healthcare workers to prioritize their time with the patients and the colleagues? Because spending less amount of times with the patients and the colleagues, that was the major factor to cause burnout. So what we can do, reduce the paperwork, reduce the bureaucratic burden. We should need an annual audit for the forms that are repetitive, redundant, and we should cut down them. We should have dedicated staff to help the doctors to, complete the bureaucratic tasks. So we should give more autonomy to the healthcare workers. They should be given autonomy to schedule the preferred off days, and they should be given options for telemedicine whenever clinically appropriate. And there should be option of job sharing, teamwork, and coverage option. Okay, if I'm not there, my colleague will cover me up for that amount of hours. Okay. So there should be a culture of healing, community and connection. That is the essence of human civilization: interpersonal, non-confrontational, non-punitive interaction. Okay. So under any circumstances, personal prejudice against anybody is a big no-no. There should be no discrimination at workplace. Someone should not be given undue leverage, and someone should not, just sabotage. That's a big no. There should be no regionalism. So thankfully, in this part of the country, being an outsider, I can proudly say there's no regionalism. Being a North Indian, I can say I was, accepted and welcomed like anything here. So the take-home message for us is, it's a global crisis, not just an individual problem. Nobody is alone into this. It has got far-reaching effects on the organization, on the society. And to make it better, it needs a sustained teamwork. It cannot be done in one day. It's a sustained teamwork. And resilience and anti-fragility, we have to make it as a reflex of our system. We have to adapt it in our system. So let's see the picture. We are stronger together. From me to we all became stronger. As what I said, it's the essence of human civilization. Let's just be humans before we become work machines.